member for Vermilion-Lloydminster.
Well, thank you, Mr. Speaker. In a recent poll, 95% of Albertans said pharmacists were the most accessible healthcare professional. Now, Alberta's 5,000 pharmacists are trusted frontline healthcare professionals in every sense of the word, and that's why it's baffling to understand why Alberta Health forced the Provincial Association of Pharmacists, the RXA, to sign a non-disclosure agreement during recent negotiations on a new pharmacy funding framework. So to the Health Minister, for a government that prides itself on openness and transparency, why was it necessary to muzzle trusted frontline professionals with a gag order?
Minister of Health.
Thank you so much, Mr. Speaker, and to the member for the important question. We respect that negotiations happen at the table, and like is the case with all organizations that we're negotiating with, including unionized groups, what we ask for is that before you communicate with your members, please let us know what you'll be saying. And that is standard practice, Mr. Speaker, and we're proud to continue that. We're also proud of the fact that we came up with an agreement that sees a 4.3% increase, which is very reasonable to ensure that we have access for drugs across Alberta, but that we're making sure that that results in the best outcomes for patients, Mr. Speaker.
Supplemental.
Well, Mr. Speaker, that's certainly not what the Pharmacy Association has told me. And given that the pharmacists administered over 50% of the flu vaccinations in Alberta last year, and given that Alberta Health has failed to meet its own vaccination targets for the past 3 years, and given that the new funding framework cuts the fee paid to pharmacists for administering flu vaccine to a level where it is no longer economically viable for them to provide this service to the minister in the interest of public health, will you at least consider restoring the previous fee paid to pharmacists for administering flu vaccinations?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And I understand that the formula was reached in the past with the previous government, with which the member was a part of, and that fee was 50% higher, Mr. Speaker, than the next highest jurisdiction in Canada. So what we've done is we've brought that fee in line to still be the highest in Canada, but not to be an outlier by 50%. We did that in partnership with Pharmacists, the RXA, and I'm really proud of the fact that we came to a good outcome there, Mr. Speaker.
Second supplemental.
Well, Mr. Speaker, you did it behind closed doors under a gag order. And given that pharmacists are taxpayers too, and they support effective measures to reduce healthcare spending, providing it does not harm patient care, and given that the RXA provided the government's hired third-party negotiator with over 40 recommendations for cost savings, none of which were incorporated into the final agreement to the minister, why did your hired gun negotiator ignore the recommendations of Alberta pharmacists?
The Honourable Minister.
Thank you very much, Mr. Speaker. What we did is we sat down at the table in a respectful way with our budget, which has, as you'll see from last year's budget, a 4.3% increase. And we said these 12% increases that were reached because of policies under the former government are not fair to Albertans, they're not fair to patients, and we need to find a way to be more sustainable. And what we did, Mr. Speaker, is we sat down with both parties and agreed on a formula will get us there. I understand that perhaps the member opposite wants to defend policies that saw skyrocketing costs at the cost of patient outcomes, Mr. Speaker, but on this side of the House, we're always going to put patients first, and we're going to do so in a sustainable way.